Thank you for joining me today. In this video, we are going to learn more about precision medicine. We are going to define what precision medicine is in psychiatry, pharmacogenetics, and explain their role in psychiatric practice. We are going to define how genetic variation influences psychotropic medication metabolism, effectiveness, and side effects of the medication. We are going to interpret common pharmacogenetics testing. Results include CYP450 enzymes phenotype. We are going to apply evidence-based pharmacogenetics recommendations to antipsychiatric medication, antidepressant medication, mood stabilizer medication, stimulant, and anti-anxiety medication. We are going to integrate pharmacogenetics testing into clinical decision making while recognizing its limitation. We are going to discuss ethical, legal, cultural, and economic considerations related to psychiatric genetic testing. We are going to go over developing individualized treatment plan using a pharmacogenetics information in conjunction with comprehensive clinical assessment. So precision medicine is a transition. Precision medicine is transforming a psychiatric practice by moving beyond traditional treatment, trial and error. So precision medicine is transforming psychiatric practice by moving beyond the traditional treatment of trial and error. This approach is to a medication selection instead of assuming that all patients respond similar to psychotropic medication. Precision psychiatric recognizes that genetics, biological, environmental, and psychiatric, psychosocial, and lifestyle factors influence both treatment and response. One of the most rapidly advancing areas of precision psychiatric medication is pharmacogenetics, the study of how inherited gene influence both treatment and response. This study is how inherited genetic variation affected medication, metabolism, therapeutic response, and toxicity. Pharmacogenetics testing provides a clinical relevant information that can help clinicians optimize medication selection, adjusting dosage, anticipating adversary reaction, and improve medication adhesiveness. While a pharmacogenetics testing does not diagnose psychiatric diagnosis or identify the best medication with a certainty, it can improve prescribing decisions, which integrate the clinical judgment, patient preference, and medical history and evidence-based practice. What is precision medicine? Precision medicine is an individualized approach to healthcare that encourages and incorporates genetic information, clinical characteristic of the patient, genetic information of the patient, and clinical characteristics, environmental exposure, medical condition, comorbidity, lifestyle factors, social determinant of health, patient preference. So precision medicine considers all these factors. Precision medicine is an individualized approach to healthcare that incorporates genetic information of the patient, clinical characteristics, environmental exposure of the patient, medical comorbidity that the patient has with them, lifestyle factors that the patient is living in, social determinant of health that applies to the patient, preference of the patient and their families. The goal is to deliver the right medication at the right time, at the right dose, to the right patient. So the goal is selecting the right medication at the right dose for the right patient at the right time. Everything has to be correct. That is the goal. So precision psychiatry is a extend this approach to mental health by integrating psychogenetic, pharmacogenetics, neurobiological, precision psychiatric extend this approach to mental health by integrating pharmacogenetics, neurobiological biomarkers, and digital phenotype, neuroimaging research, and clinical symptoms profile, long duration treatment response. Although many precision psychiatric tools remain in investigation, Pharmacogenetic testing increasingly uses clinical practice and use clinical practice for selecting a patient. Pharmacogenetics. What is pharmacogenetic? Pharmacogenomics. Pharmacogenomics is a drug genomics. Pharmacogenomics is the study of how the gene variation affected drug absorption, drug metabolism, drug distribution, drug elimination, and drug targets, and medication efficiency and side effects. Most clinical actions in psychiatric pharmacogenomics testing focus on drug metabolism, particularly enzyme within the chromosomes. Metabolizer phenotypes. Individuals are categorized according to the enzyme activity. Poor metabolism characterized little, no enzyme activity, slow drug metabolism, higher serum drug concentration, greater risk adverse effects. Clinical implication of a poor metabolism is low doses may be required. Low doses may be required. Alternative medications may be needed because it has higher drug toxicity, high risk of adverse effects. So that makes that requires a lower dosage. Intermediate metabolizers characterized by reduced in enzyme activity, metabolic drug accumulation, potential need for dosage adjustment. Normal metabolizers. Normal metabolizers are typical enzyme activity. They have a typical enzyme activity, standard dosage, generally appropriate. However, rapid metabolizers characterized by fast than average drug metabolism because they are rapid metabolizers. Low drug concentration, it has a low drug concentration, and the possibility of a drug efficiency. They have a possible reduced drug efficiency. Ultra metabolizers characterized by remarkable increase of metabolism, subtherapeutic drug concentration, because they go from the body faster. Their therapeutic is subtherapeutic concentration. Thus, they require higher risk of a treatment failure. They have a highest treatment failure. Alternative medications are not primarily metabolized by affected enzyme may be appropriate. Alternative medication not metabolized by the same enzyme may be appropriate. So, for example, enzyme CYP2D6 clinical applications include number of antipsychiatric and antidepressant medications are metabolized by this enzyme. And this enzyme is a CYP2D6. Some of the examples that the medications that metabolized by this enzyme include fluoxetine, paroxetine, venlafaxine, raspadol, barbazole. Those medications are metabolized by the CY2D6 enzyme. Poor metabolizers may experience excessive sedation. Poor metabolizers may experience excessive sedation because the drug is accumulated in their body. Instead of metabolizing, the drug stay in their body and they are not metabolizing. So there is a build up of toxicity. They have a drug toxicity. They have orthostatic blood pressure because it affected their blood and it will lower their blood pressure. They have a higher hypoprolactemia. They have EPS symptoms. So it increased the side effect of the drug in their body. It increases the risk of toxicity in their body because the drug is not going faster from their body, it stays there. Ultra-rapid metabolizers may experience inadequate symptom control. Because the drug is not effective. Let's say they have a depression and they are taking depression medication, and that medication goes from their body quicker. They metabolize that drug quicker. So the medication is not doing the indication. It's not controlling the symptoms. This may experience reduced medication response because medication is going from their body quicker. Apparently treatment resistant. They are not treatment resistant, but the medication is going their body faster. Enzyme metabolic enzyme CY2Z19. This enzyme is CYP2C19. It metabolizes antidepressant medication. This antidepressant medication include citalopram, escitalopram, Zoloft. Poor metabolizers for this medication has a potential consequence of elevated blood concentration, increased side effects because this antidepressant medication stay in their body. So when the person is not metabolizing the medication and they are poor metabolizers, the medication build up in their body, so the serum plasma concentration is higher. They have increased side effects. They have a greater risk of QT prolongation. Ultra metabolizer of these medications has a potential consequence of reduced medication efficiency, resistant depression or anxiety symptoms, because the medication, they are wasting the medication. The medication is going to their body faster, so it's not going to control the symptoms of depression and anxiety. Pharmacogenomics by the medication class antidepressant medication such as SSRIs and SRIs or triglyceric antidepressant. Pharmacogenomics testing may help explain unexpected side effects, non-respond need for usual high dose or low dose. It may explain those phenomena. Psychiatric medications genes that involve metabolism include CYP2D6 and CYP3A4. Those are the enzymes that involve antipsychiatric medications. Potential benefit of testing these enzymes include reduced EBS symptoms, improved dose selection, better identification of a patient at risk for toxicity. However, a clinical response to antipsychiatric remains strongly influenced by non-geno factors. Mood stabilizer. Routine pharmacogenomics testing is not recommended before initiating the lithium, valproic acid, lamotrigine. Clinical monitoring remains the primary strategy at this time. Stimulatories. Evidence for pharmacogenetics guide prescribing is currently limited. Evidence for pharmacology genomic guide by prescribing is currently limited. Medication selection include continue to rely primarily on clinical response, side effects, and patient preference. HLA testing. HLA testing is a certain human leukocyte antigen alloys predict a severe ammonia-mediated adverse reaction. Carbamazepine testing for human leukocyte antigen alloy is recommended in the patient with ancestors associated with higher prevalence of this alloy. Before starting the medication carbamazepine, because of the increased risk of Stevens-Johnson syndrome and toxicity epidermal necrosis. So this medication causes epidermal toxicity and causes rash on the body. So human leukocyte antigen alloys targets that enzyme. Clinical indication for pharmacogenomic testing. Testing may be considered when the patient have multiple and successful medication trials. So clinical indication for pharmacogenomic testing include when the patient fails different treatments and expected medication toxicity that you want to investigate and say, why is this happening? And usual sedation to standard dosage that shows the medication is higher, so you want to test that. Need for medication with established pharmacogenomics guidelines, strong family history of unusual medication responses, complex polypharmacy where metabolic pathway may influence treatment decisions. Protein testing before prescribing if every psychotropic medication is not currently recommended. Thank you for joining me today. I would love to see you in my next video. Please subscribe.